everybody. My name is Paul Daniels, and I am a member of Carthage Council number 41 in Carthage, Missouri, and currently the Grand Captain of the Guard for the Grand Council of Cryptic Masons of the state of Missouri. I'm going to be talking to you today about the Cryptic Masons Medical Research Foundation, otherwise known as CMMRF. So bear with me. They told me I only had an hour and a half to do this. I'm not sure what I'm going to do with all that time. No, actually, they only gave me 10 minutes, so I think you can bear with me for that long. First of all, we're going to talk about the history of CMMRF. CMMRF started in March 6th of 1986, and remember that date because we're going to be talking about that a little bit later in the presentation and why that's significant. But CMMRF was incorporated in the state of Oklahoma on that date. In February 1996, the CMFR Board of Trustees agreed to fund a chair at the Indiana University Medical Center at the cost of $1 million, which means that they believed enough in the research that they thought it was worth contributing to. Early in 1999, Keith L. March, MD, PhD, was named the first CMMRF chair. 2001 and 2002, the laboratory, sponsored by CMMRF at Indiana University, was renamed the Indiana Center for Vascular Biology and Medicine, otherwise known as ICVBM. 2007, a non-Masonic benefactor challenged CMMRF to match his $50,000 donation to the Indiana Center of Vascular Biology and Medicine. In 2008, a Cryptic Mason donated $20,000, with CMMRF matched and enabled Cryptic Masons to give $240,000 to ICVBM for research in 2008. In April 2012, the ICVBM Center was tapped to join the Cardiovascular Cell Therapy Research Network. The reason this is significant is because the research was significant and it was being picked up by other organizations because of its significance. In 2013, CMMRF exceeded the $3 million mark in donations to the Indiana University ICVBM. In July 2018, Dr. Michael Murphy selected chair of the Cryptic Masons Medical Research Foundation. Now I want to present to you the Executive Secretary of CMMRF, Brother Gary Wine. Actually, Brother Wine and Brother Joe Elson, who was Grand Master in 2017, are the ones that kind of inspired me to adopt CMMRF as a pet project. I first heard Gary Wine present at the state conference here in Missouri, and I believe he recently presented at the triennial. So if you can look that up on YouTube, it's a very, very good program. I certainly will not be able to match the quality of that, but I'm going to try to be informative. Now there's a lot of technical data when it comes to research and CMMRF, but I think you might notice that these are all common health problems that have touched us all. When Gary Wine does his presentation, he asked people to stand who either have had these problems or know somebody that has these problems. And by the time he gets about halfway through this list, pretty much everybody in the room is standing. So the common problems that CMMRF are working on are stroke, COPD, chronic obstructive pulmonary disease, heart failure, juvenile diabetes, otherwise known as type 1 diabetes, peripheral artery disease, and abdominal aortic aneurysms. As far as strokes are concerned, the mortality rate globally in the world is 11.8%. Every 2 seconds, someone in the world experiences a stroke. Every 10 seconds, a stroke claims a life. And worldwide, there are over 6.2 million deaths each year due to stroke. CMF current research has helped develop a clot-busting therapy. I'm sure most of you are aware of that if you get to the emergency room soon enough or the hospital, then they can administer this medication that can hopefully bust up the clot that's causing the stroke and lessen the impact of the stroke. CMMRF has also done research in the area of stem cell therapy that is leading to new treatments for strokes and cerebral palsy that can be applied up to 36 hours after the onset of the strokes. This is really fascinating information. It's too technical to explain here, but the work they're doing is just really amazing. By the way, cerebral palsy is stroke at birth, and to think that if a child experienced that they could one day administer medication that could hopefully at least lessen the effects of that is just absolutely amazing. COPD is another area that they're working on, chronic obstructive pulmonary disease. COPD actually stands for a group of lung diseases that block airflow and make it difficult to breathe. Most common ones that we know of are emphysema and chronic bronchitis, but they can also include things like lung cancer and chronic asthma. COPD is anticipated to become the third leading cause of death by 2021, which is next year. That's a pretty big problem. COPD affects 600 million people worldwide and is a major consequence of environmental exposures to toxins, particularly tobacco smoking. CMMRF research and treatment for COPD has been very significant as well. Stem cell research in rats has shown decreased deterioration of lung structure and function in rodents exposed to daily tobacco smoke. In the future, sometime in the near future, actually, CMMRF is currently working to arrange clinical trials to evaluate this very treatment in patients with COPD. And we have heart failure, which is obviously known by everyone. It accounts for 31% of deaths globally and are attributed to cardiovascular disease. 17 million people each year die from cardiovascular diseases. 85% of all cardiovascular disease deaths are due to heart attacks and strokes. CMMRF has been working along with the Cardiovascular Cell Therapy Research Network and has participated in what's called the Seneca trial, where they utilized a direct cardiac injection of cells for the treatment of cardiac-related problems. CMMRF is currently collaborating with Dr. Meijing Wang to use 3D bioprinters for creating beating scaffolds in the heart. These scaffolds will be used to surgically replace parts of a heart that has been damaged by a heart attack. This is just kind of blow your mind type of research that if I did have an hour and a half, I might be able to explain it. Now we want to look at the impact of juvenile diabetes. 422 million adults globally have diabetes. There are 3 million cases in the U.S. every year. 200,000 of these cases are juvenile onset diabetes. Diabetes was the 7th leading cause of death in 2017. In 2020, diabetes has moved to the 5th leading cause of death in the U.S. So this is definitely what we consider an emerging problem. CMMRF research in this area has discovered that juvenile diabetes, or type 1 diabetes, is actually an autoimmune disease. This is a very significant finding in terms of developing a treatment. Current research is focusing on a treatment to correct what they call defective T cells or white blood cells and effectively treat juvenile diabetes. So this may actually prevent these children from having diabetes throughout their lifetime. CMMRF is also doing research in the area of peripheral artery disease, known as PAD. PAD is actually a form of atherosclerotic cardiovascular disease. Now, atherosclerotic is basically hardening of the arteries, is the older term for that. Globally, PAD affects 236 million people every year above the age of 25. PAD affects approximately 8 million people over age 40 and older in the U.S. PAD is the third most prevalent form of atherosclerotic cardiovascular disease after coronary heart disease and stroke. CMMRF research and treatment for PAD has helped to define the mechanism by which stem cells can prevent amputation for PAD patients. Amputation is often a consequence of PAD. This research was funded by the National Institute for Health and won an award from the American Heart Association for the best research paper in the U.S. Research has helped to develop a model to test new cells that secrete specific signals to make blood vessels grow. So these would make the blood vessels larger and longer, which hopefully would help treat the PAD. CMMRF is currently working with Harvard University and the Texas Heart Institute in developing stem cells to treat PAD. One study is actually in the approval for clinical use phase with the FDA. The next area we're going to look at is abdominal aortic aneurysms. The aorta is the main blood vessel that delivers blood to your body. An abdominal aortic aneurysm is caused by enlargement of the aorta, otherwise known as an aneurysm. Abdominal aortic aneurysms affect 6 to 8% of the population globally. Only around 50% of the patients who experience a rupture of an abdominal aortic aneurysm survive. The survival rate drops 1% per minute, even when that patient gets to the hospital. Abdominal aortic aneurysm often grows slowly without noticeable symptoms. CMMRF research and treatment for abdominal aortic aneurysms have discovered that they are also the result of an autoimmune response to certain proteins. The research has also identified a biomarker that can predict the presence of abdominal aortic aneurysms in patients. So a lot of times these problems go undetected, and soon we'll be able to do a simple blood test and find the presence of this problem. Research also from CMMRF has been the first in the world to discover a stem cell that can actually turn on immune regulatory cells and prevent aortic aneurysms expansions. So once an aneurysm is detected, we soon may be able to treat that with stem cells that would essentially stop that expansion. CMMRF was the first to launch a clinical trial funded by the Veterans Administration that is treating patients with stem cells to prevent aneurysms expansions. After doing the research for this presentation, I've become more and more interested and actually really astounded with the research that's being done by CMMRF, and the reason is because it does affect probably someone you know or have known. And some important points to take away from this is that CMMRF is our charity. It's a Cryptic Masons adopted charity. CMMRF contributions has not only funded research, but has also led to treatments. Research is sometimes difficult to understand and process and find a meaning for it, but when it leads to treatments, it begins to make a whole lot more sense. CMMRF research and treatment are all about issues that affect us. CMMRF has produced results. I would encourage everyone who's listening to this presentation to go to cmmrf.org for more information. While researching the numbers for this presentation, I learned that when you focus on an issue and promote an issue, then things will improve. Over the last 5 years, Missouri Cryptic Masons have donated a total of $24,523.86 to CMMRF. Between 2015 and 2017, our donation totals were $5,689.50. Since beginning CMMRF month in 2017, our totals have increased. Between 2017 and now, our donations rose to $18,834.86. Missouri is currently listed as 12th in the national CMMRF contributions with a lifetime donation of $138,877.36. Here are some things that you can do in your own council. March 6th of each year, remember that date I told you to remember at the beginning? March 6th of each year is CMMRF Foundation Day, when we recognize the conception of CMMRF. The Ground Council of Cryptic Masons of the state of Missouri has designated the entire month of March each year as CMMRF month. The Grand Master encourages each council to have CMMRF education and to hold fundraising events during March to increase our contributions to CMMRF. So this would be a great time to do presentations and promote the learning and understanding of CMMRF. Each regional Deputy Grand Master and all officers in each council are asked to increase the awareness of CMMRF. For more information, contact CMMRF at cmmrf.org or the Missouri Grand Council of Cryptic Masons at moyorkrite.org. Remember to pass the donations to the Grand York Rite office so that the Missouri Cryptic Masons can get credit for their donations. It's been my pleasure to present this topic to you today. I hope that you have enjoyed this presentation and it has been informative and inspiring. And I also hope that you will use this information to go and inspire others to contribute to this worthy and meaningful cause. For those of you that do contribute, there's recognition for your contributions. Probably the one that most of us know about or should know about is the Penny a Day program. For contributing $3.65 each year to CMMRF, you will get a sticker that you can put on your dues cards. Now, this may not sound like a whole lot, but it's actually fairly significant, because if 2,500 members give $3.65, that adds up to over $9,000 in contributions. So please remember that when the dues notices come out, to check the box, or however your solicitation is set up, and give to CMMRF. Recorders, remember to request the Penny a Day donation and collect it when you're collecting dues. Members giving at least $100 to CMMRF will receive a Purple Heart pin and a solid bronze commemorative medallion from the Grand Master. CMMRF also recognizes donators. At the $50 level, you'll receive a bronze lapel pin. For $100, you'll receive a bronze lapel pin with a jewel. For $150, you'll get a silver lapel pin. For $300, you'll receive a silver lapel pin with a jewel. And for $500, you'll receive a gold lapel pin. $750 donors will get a gold lapel pin with a jewel. And for $1,000, you will get a plaque. And for every $1,000, a diamond chip will be added to a gold lapel pin. Upon request to CMMRF, they will match 5,000 donations up to $25,000. There are a few different ways to donate. When you donate through the penny a day, that goes through your local recorder and then is sent on to the grand recorder and then eventually on to CMMRF. That way you, your council, and the state of Missouri make sure to get credit for those donations. You can also write separate checks that can be sent either through your local recorder or directly to the grand recorder's office. And this is the preferred method of donations for the Grand Council, mostly because that is the easiest way for us to track those donations. You can also go through the CMMRF.org website, and they have various different options there for either one-time or reoccurring donations. And you can choose the frequency that you want to make those donations. Make sure when you're doing this to list your state and your council. Here again, that's the only way that you, your council, and the state of Missouri will get credit for those donations. And why do you want to get credit? Well, as I said earlier, there's rewards for those various different levels of contributions. One thing I do want to emphasize is do not use PayPal. If you use PayPal through the CMMRF.org website, the only information that CMMRF gets is your email address. So therefore, they are unable to track your council, or your state. Thanks again for allowing me to present today.